Hi, I'm Dr. David Hill, and today we're going to be talking about how to treat gastroesophageal reflux disease. Now, nobody wants to say all that, so we usually say GERD, or if you want to shorten it up, GERD, right? So what is gastroesophageal reflux disease? Well, the contents of the stomach, the acid and whatever you've been eating or drinking, wash from the stomach back up into the esophagus. That's not where those things belong. They cause damage up there. The esophagus is not good at protecting itself from stomach acid the way the lining of the stomach is. So that can be a real problem. In fact, it can cause erosions in the esophagus. In the long term, that can lead to scarring. It can lead to a precancerous condition called Barrett's esophagus, and that, of course, can progress to esophageal cancer. So treating that is a really, really important thing to do. The first thing you want to do is confirm what it is. Not everybody who has chest pain under their sternum here has gastroesophageal reflux disease. Some of those people have heart disease. So do talk to your doctor if you think you might have reflux, especially if you're older, if you're a smoker, if you are a woman, because middle-aged and older women get heart pain that they think is reflux. Their chest pain tends to present in less traditional ways than men's chest pain. If you have diabetes or other risk factors for heart disease, don't ignore the fact that this may not be reflux at all. If, however, you have obvious or diagnosed reflux, you'll want to start getting it treated. This is not something to leave lying around. The first step of treatment is lifestyle change. If you're drinking a lot of caffeine, stop. If you're drinking a lot of alcohol, stop. If you're smoking cigarettes, stop. See a pattern here? If you are eating a lot of greasy or fatty foods, that's right, stop. If you're eating right before bedtime, eat a little earlier. Have smaller meals instead of larger meals. Lose weight if you're obese. Elevate the head of your bed by about 20 degrees or 15 degrees and see if you can sleep on a little bit of a slant. Sleep lying on your left side instead of your right. These are all lifestyle changes which may help reflux. That said, lifestyle changes are relatively weak in terms of helping reflux, so then you're looking at medication. The question is what medication and when? Well, there are 3 tiers of medication. In the moment, you can use an antacid, something like Tums, Maalox, or Mylanta. Those medications neutralize the stomach acid temporarily, but they're not good long-term fixes. They'll help you get through the night or feel better in the moment. The next class of medication you can use is called an H2 antagonist. That stands for type 2 histamine receptor. These medicines are actually related to the antihistamines that you take for allergy, but they work on the kind of histamine that causes the stomach to secrete stomach acid. You know these medicines because you've been hearing them for years. Ranitidine or Zantac, cimetidine, nizatidine. These are all available over the counter. They all work for a little while, but after a couple of weeks they tend to lose their efficacy. So if you've been using them for a couple of weeks and you notice your symptoms coming back, it's time to try something new. What would you use that's new? You would use a proton pump inhibitor. Now, one of these is over the counter. That's omeprazole or Prilosec. And you can take that once or twice a day for 2 to 4 weeks and see if you get better. If that medicine is not helping, it's time for prescription medicines or for combining 2 or 3 different classes of medication. It may also be time to see a stomach specialist, a gastroenterologist, to see if he or she needs to look down into your esophagus and look for signs of damage caused by gastroesophageal reflux disease. So at that point, you really want to seek help from a doctor to get this disease under control. Again, it is not something to let go on forever. So do talk to your doctor if you're having these symptoms for more than a couple of weeks. Talking about how we treat gastroesophageal reflux disease, I'm Dr. David Hill.